Okay, so hello everyone. My name is Piotr Wędrowski, and I would like to tell you a few words about the chemotherapy. Just about this picture, if you are curious whose hand is that, it's actually my hand. When we are talking about chemotherapy, the first word which comes to our mind is tumor. But what is a tumor, actually? Our body has a DNA, right? And the DNA is a blueprint of each cell in our body. So how to create each cell. And tumor is a DNA mutation, which means that our body cannot, our DNA is damaged somehow, and such a cell is copied with this mutation, and that's how the tumor starts. We have three types of tumor. One is a cancer, the second is a sarcoma, and the third one is lymphoma. Treating a cancer and sarcoma starts with a surgery. That's the very first thing which we should do to treat a sarcoma. When we talk about lymphoma, then it is a little bit different approach, because lymphoma is treated very well with chemotherapy. And we will focus on the chemotherapy in this presentation. There are actually two things which are curious. First is tumor is not always a cancer. And the second is a cancer is always a tumor. Let's talk a little bit about chemotherapy. In chemotherapy, we use chemotherapeutics, also called cytostatics. I always thought that cytostatics or chemotherapeutics are liquids. Liquids are prepared already, but they are not. They are in a powder, actually. All chemotherapeutics are a powder. And the powder is mixed with a physiological fluid, and then it comes a fluid which is actually chemotherapeutic, such a drug. It means a drug. And it can be, sometimes it has beautiful colors. That's why in hospital patients sometimes call the chemotherapeutics lemonade, because they actually look like a lemonade, red one or yellow one. But actually, how the chemotherapeutics works. So there are three approaches how they are working. First one is attacking cancer cells. Attacking, which means attack cancer cells, which means that changing cancer cell DNA so that cancer cell receives a signal to destroy itself. A second approach is that chemotherapeutics are stimulating our antibodies to destroy tumor cells. So our antibodies now can see the tumor cells and can destroy them. And the third approach is changing the DNA of the tumor cell such a tumor cell cannot copy itself. So those are three approaches how the chemotherapeutics works. But all of that, drugs, chemotherapeutics, is only a halfway of the treatment. The second half is in patient's brain. Thank you very much.